I think there's also a good future for patients in the sense that the message is that with more specific, personalized approach of their particular disease, it will become possible to wipe out disease in more and more patients without significant toxicity, and I think that is a major step forward. We have been using allogeneic transplantation, autologous transplantation, high-dose chemotherapy, all the complications there. And I've been a transplanter for the greater part of my life, but now we are entering the era that with more sophisticated approaches, more targeted towards the tumor cells, we can reduce the toxic side effects and still maintain the good results or even better results. I'm working in an academic setting, so we are running many trials. There are diseases where you can easily be treated in a smaller peripheral hospital with the modern drugs available. But if it gets a more aggressive disease or if there is relapse, I think patients should really try to turn to studies where all these new modalities are now being sorted out. For instance, in Holland we have the HOVON collaborative group where we do run studies, and now in a specific subgroup of HOVON, the Lymphoma Lymphoma phase 1-2 consortium, we just get all those new molecules from the companies. We have a network with the companies in the United States, in Europe, in Japan, and we get those compounds, those new promising molecules to be given in phase 1 trials, phase 2 trials, early clinical studies to our patients in the Netherlands. And patients come from all over to the LLPC centers, that's about 9 hospitals in the Netherlands that are active in that field. So that makes those new compounds, those new molecules available. Continuously becoming more important issue, the quality of life, because the cure rate is going up step by step. Hodgkin's lymphoma is the prime example where the major question is not how to cure a patient, but how to preserve the quality of life. Because we know by now that of the cured Hodgkin lymphoma patients, 30 to 40% suffers from severe fatigue in a chronic way for years and years. And that is dreadful because young men cannot go to work, young women that run a family have to get to rest, to bed in the afternoon. So we should also focus on these most important quality of life issues. We are establishing or have a brainstorm shortly, early next year in the Netherlands with the 5 Hodgkin groups in Europe to establish another Lymphoma Lymphoma fatigue consortium, specifically focusing on how we can develop treatment methods to reduce fatigue. That's with cognitive behavior therapy, mindfulness, physical exercise. So we are collecting a group of hematologists that know everything about Hodgkin's lymphoma, together with psychologists and movement scientists, physical therapists that know a lot about how to treat fatigue. That's one of our new challenges.